So how long ago did your pain start?
It started about 3 weeks ago.
Okay. Was there anything you can think of that brought on the pain?
Nothing really in particular. We recently got really busy at work and about the same time that my pain started, and I've been under a lot more stress lately.
A lot more stress?
Yep.
Okay. Can you describe the location and kind of the type of pain that you're having?
It's like right in the middle of my back, like right up in here, about halfway up my spine, and my pain, it just really aches, and it can be pretty intense at times, so it keeps me up at night a lot of the time.
Okay. Any aggravating factors? Anything that you do that kind of increases the symptoms?
It's been hard to recognize a pattern as far as what makes it worse or better, but I do find it feels better when I'm like laying on my back and I'm trying to relax.
Okay. Your past medical history, so is there anything you can tell me? Have you had cancer, heart disease, hypertension, family history, diabetes, anything of that nature?
So I was born with mild scoliosis, but I haven't really had any issues my whole life. No major illnesses or surgeries. For family history, my mother did have osteoporosis, and my father had lung cancer, but I've been lucky.
Okay. So no surgeries. Okay. Do you have any pain in your neck or in your low back?
Sometimes I get some pain in my back, but in the low back, but really nothing in my neck.
Okay. So I want to kind of mark down your pain severity. So on that 0 to 10 scale, what has it been in the past week at its worst, at its best, and then what is it right now?
So I'd say the worst it's been is about a 6, and the best was probably a 0 out of 10.
Okay.
And right now I'd say it's about a 4 out of 10.
4?
Mm-hmm.
Okay. What type of work do you do?
I work at a veterinary clinic as a receptionist. I've been helping out as a tech since we lost our main tech 3 weeks ago.
Okay. No fun?
No, not really.
What type of living environment are you currently in?
I live with both my children. They're 2 and 5, in a 1-story, 2-bedroom home that I rent from my dad. There's about 2 steps to get inside the house and about 10 to 12 steps to get to the basement.
Okay. Can you describe kind of your physical activity level before and like now?
Before, I would say I was pretty active, but as of right now, I've just been really tired and busy, too busy to exercise.
Okay. Any other symptoms that occur when you're experiencing the pain? Any numbness, tingling, things like that?
Not really, it's just an achy pain. I don't have any numbness or tingling. I would just say that sometimes it feels deeper, so I have my daughter rub my back, and it doesn't really seem to help much.
Okay. Do you have any troubles with bowel and bladder issues, anything like that?
I think it's fine, but I guess I've recently been urinating much more frequently over the past few weeks, but I just feel like it's stress related, so.
Okay. And you said your sleeping quality, you're waking up a lot at night?
Yeah. I've had some difficulty sleeping the past few weeks. It wakes me up at night, but I'm also a light sleeper, so maybe I just wake up anyway, but I do notice the pain when I wake up.
Okay. All right. Thank you.
Yep.
How long ago did your pain start?
Approximately 1 week's time has passed since I first noticed the pain.
Okay. Was there anything you can think of that brought on the pain?
You know, it's very interesting to bring that up because about 3 days prior to first noticing the pain, I had been removing drywall in our home. You see, our home was damaged in a flood, you see. And the work wasn't too strenuous, but I think that that I may have strained something or injured my back somehow. There's really nothing else I can point to.
Okay. Go ahead and try and describe the location of the pain that you're having, and as well as the type of pain.
Yes, let me describe it to you. It's right around the middle of my upper back,
Okay.
and sometimes will wrap around my rib cage on the left side, like here you see.
Okay. All right. Is there anything that you do kind of in your day-to-day routine that aggravates the symptoms?
Most certainly. Anytime I exert myself, my symptoms worsen. And I try to play with my dog, but as soon as I start, the pain will flare right up. And I tried taking some ibuprofen to ease the pain, but it doesn't seem to do the trick.
Okay, so nothing you do relieves the pain?
No, sir.
No. Okay. What about your past medical history? Any history of cancer, heart disease, hypertension?
Well, you see, I had my right rotator cuff repaired approximately 3 years ago after a construction accident. And otherwise, I've been pretty lucky. And my father passed away from pancreatic cancer 10 years ago.
Okay. Is there any pain in your neck or your low back?
No, I have a little back pain every now and then, but I don't think it's related to this.
Okay. What's your pain at its best in the past week on a 0 to 10 scale? 0 being no pain at all, 10 being we got to call an ambulance.
I would say that my pain at best is around 2 out of 10. And at worst, it's about 7 out of 10.
Okay.
And right now, I'd mark it about a 3 out of 10.
3?
Yeah.
What type of work do you do?
I'm a part-time owner of a construction company, and I work approximately 50 hours a week.
50 hours?
50 hours, sir, yes.
Give or take. It's a lot of work. Give or take. It's a lot of hours.
When it's your passion, it's totally worth it.
I agree. Can you describe to me the type of living environment that you're in right now?
Yes, I live in a 2-story home with my wife and my daughter.
Okay. Can you kind of describe your physical activity level, kind of up until the point where you injured yourself?
Well, yes, I can for you. Just a second here. I should exercise more, but I feel I'm very active at work, and I'm just too exhausted when I get off work.
Okay. All right. That's all the questions that I have. I lied. I got a couple more questions for you.
All right.
Do you have any other symptoms that occur when you're experiencing the pain? So any numbness or tingling in your back?
No, nothing appears to be numb, and there's no tingling.
No tingling? Okay. What about your bowel and bladder habits? Do you have any issues there?
I haven't had any issues with that. No, sir. No, sir.
Okay. And your sleeping quality, how's that been?
I wake up about 4 to 5 times a night because of pain. I usually wake up in a sweat. And I think that some of this has to do with the fact that I'm fighting a cold right now.
You've had a cold for a
A
little
cold. Yes, I've had a cold. I would say 5 or 6 days ago the cold started. And no troubles breathing, but whenever I take larger breaths, I can feel the pain increase in my back.
That was my next question. Okay. All right. Thank you.
Thank you, sir.
How long ago does your pain start?
I'd say about like 5 years ago.
Okay. Is there anything you can think of that brought on the pain when this happened?
Yeah, about 5 years ago, I was assaulted by a customer at work one night. I was tackled to the ground and thrown onto my back onto a marble floor.
Ooh.
With the customer on top of me, and I was in pain the next day, and I wasn't able to go back to work for several weeks because of the pain that I was in.
Okay. No fun there, huh?
No, not at all.
Can you describe your symptoms and kind of point to the location?
So it's in my buttocks, and then it travels down like my lower left leg, and it goes all the way down into my great toe, or my big toe.
Okay.
I kind of get some like numbness and tingling on like my right butt cheek, and along my lateral thigh. So I'd say it varies between like a mild ache and like sharp burning sensation some days. So.
Okay. Any aggravating factors or things that make it better?
The pain is worse when I'm like standing and walking around, but it gets better when I'm laying down, relaxing. So.
Laying down.
Yep.
Okay. Can you describe to me kind of the pain severity?
Running start.
Well, right now it's about a 5 out of 10. The best it's been is a 4, and like the worst it's ever been is a 9 out of 10.
Okay.
So what did
How's your past medical history? Is there anything that you think I should know?
Well, I've been told that I have sciatica on my right side, and it has like over the past few years it's been like mild and severe pain. But my neurologist thinks that I have an L5 root concussion, so other than that I've been pretty healthy.
Okay. Are you currently working?
Yeah, I'm a part-time waitress.
Part-time?
Yep.
Can you describe to me your living environment right now?
I live in a 1-story house with my kids. I'm a single mother of 2. My kids are 6 and 8. So I've been very active. They're very active, and so it's hard for me to keep up with them due to the pain that I'm in.
Okay. What about your current physical activity level?
I'd say I was pretty active. I'm pretty active because my kids keep me on my toes. But plus I'm a waitress, so I'm on my feet for long hours, and I'd say I have like a healthy diet.
Okay. What activities are you currently unable to do?
Right now it's really hard for me to walk long distances, and my kids always want to go on walks, and it's really hard for me to keep up with them because of the pain. I'm also having a really hard time at work. It's just too much, and I'm not able to do long shifts anymore.
Okay. What are your goals for therapy?
I just really want my pain to go away so I can play with my kids again.
Okay. So how long ago did your pain start?
My pain started 3 weeks ago. I actually woke up one morning with like severe pain in my low back and hip, and I was transported to the ER. I was given an injection for some pain relief, and then they sent me home with a muscle relaxant for my back spasms. So.
Okay. Was there anything that you can think of that brought up the pain?
Nothing that I can think of. I've had like some low back pain for the past 5 years, but it's been like on and off, so I don't know.
Okay. Can you describe your symptoms and maybe point to the location?
Yeah, so it's in my low back, more on like my left side here, and then it goes, sometimes it like moves up into my abdomen and like in my butt, and sometimes onto like the anterior thigh on my left side.
Okay.
So it's a severe constant ache all the time.
Okay.
So.
Is there anything that you can do to relieve your symptoms, or is there anything that kind of makes them a little more irritable?
So like sitting for long periods of time really like upsets it. Walking, and then also when I have my time of the month.
Okay. It's okay. It's part of life.
Yeah.
So anything that alleviates the fact there's nothing?
Nope,
Okay.
nothing makes it better. It's just constant pain.
All right. So I want to try and get like a degree of your pain. So kind of on a 0 to 10 scale, how would you rate your pain, with 10 being an emergency room, 0 being no pain at all?
Well, the best it's ever been is a 7 out of 10, and the worst is like a 9 out of 10. And right now it's a 7. It hurts
Right now it's a
really
7.
bad, yeah.
Okay. How's your past medical history?
So I have like a mild right lumbar scoliosis. I haven't had any surgeries, and my family, they have rheumatoid arthritis and hypothyroidism. So.
Okay. How have you been sleeping?
Right now, I'm only able to sleep for about an hour or two at a time, just because the pain just hurts so much. So.
Okay. So are you currently working right now?
Yeah. Well, yeah. I work as full-time no, I don't work right now.
You're not working right now? Okay.
No, because it's too painful.
It's too
But
painful.
I'm supposed to work full-time at a public affairs office, so
Okay.
I just sit at a desk all day long. But as of right now, I can't.
Okay. Okay. How's your living environment?
I actually live in an apartment with my roommate. We live on the 3rd floor, so there's about like 24 steps to get up to the 3rd floor.
Okay. What's your physical activity level at right now? You said.
Well, right now I can't really do anything, but before I was able to go on hikes and bike rides with my roommate, so, but I can't do that. And, yeah.
Okay. So, besides, are there any other activities that you're unable to do? Or are those just kind of the main ones?
Yeah, those
that
are
you-
just
that
the
you don't
main
fit in?
ones, like walking, long distances, and then obviously I'm having a really hard time at work, so.
Okay. What are your goals for therapy?
I just want the pain to go away so I can go back to work and, go back to hanging out with my roommate, going on hikes and stuff, so. Yeah,
Okay.
I hate not being able to do the things I love to do, so,
Yeah.
yeah.
Don't we all?